well, can I just say, I don't want to follow Gillian and yourself. So you were brilliant. So my name is Darina Dunne. I'm here really because I want to change the health of the nation. But to do that, I probably need to take a step back. So in my day job, my professional career, I'm global head of vaccine production for Merck, one of the largest life science companies in the world. But my true passion is physical activity. I've been involved in the Irish fitness industry for the last 20 years, from organising one of the biggest CrossFit events in the world, the Filthy 150, to helping my husband run gyms. So I kind of have a unique position. I have a foot in both camps, pharmacology and physical activity. That's why I can say with like true meaning and confidence, the way to a healthier Ireland and to healthier, happier kids is not more and more medication, but more and more movement. You know, we're really at a crossroads in the health of the nation. You know, today we spend, or will do by the end of this budget, about 30 billion on a healthcare service. But we're getting sicker, not healthier. You know, our healthcare system is set up predominantly for disease management. We spend 98% of that 30 billion on treating disease and only 2 to 3% on prevention. You know, we have doubled our spending on pharmacology in the last 10 years. Now, it seems insane to say this, and people don't believe this statistic when I say it, but 62% of people in Ireland over the age of 45 are on polypharmacy. That means they're taking more than 5 medications a month, and it's only getting worse. And we really have to do something about it. And what really can have the impact, and it's irrefutable, is increasing people's physical activity, cardiovascular fitness and strength. And you know, anecdotally, we all know in this room, because it's our lives, the impact that physical activity has. But at a population level, people don't know that. You know, we go, oh, we must do it, it's good for you. But generally, people don't know that if you just meet the National Physical Activity Guidelines, which is 20 minutes of cardiovascular fitness and 2 to 3 strength training sessions a month, you reduce your risk of all-cause mortality by 40%, cancer by 40%, cardiovascular disease by 45%. And the one that's particularly important to me, because my mum has it, is dementia. Like in Ireland, dementia is going to double over the next 10 years. But if we can keep people in midlife, in good cardiovascular and strength health, we reduce their chances of getting dementia by 80%. 80%. And we're not telling people that, and we're not showing them it. And that has to change. And that changes with us. You know, I don't think people recognise the importance or the significance of the Irish fitness industry. And I think a big part of that is we've been left down by our representation. You know, there's more people going to the gym and doing personal exercise than GAA, football and rugby combined. But we don't have that conversation. It's not supported. There's over 1,000 gyms in the country, 16,000 fitness instructors. That's 3 times the number of doctors, but we're not utilising them. You know, I got the Institute of Public Health to do a survey for me to interview GPs on their level of awareness of the National Physical Activity Guidelines. And these are the guidelines our own government put out that say everyone must do. And only 5.6% of doctors could say what the National Physical Activity Guidelines were for children under 12. Our health professionals don't even know this, but we do. And we need to be the foot soldiers that gets that message out there. You know, like not only are we bigger in number, we're in every town and village in the country. Like when I started this project 14 months ago, I was amazed. Like Achill Island, population of 2,500, has 4 boutique fitness gyms and only 1 doctor. Ranafast, up in Donegal, a population of 145, and there's a gym. We have a huge level of impact, and we're just not being utilised. When we talk about, you know, getting people, kids, doing exercise and getting them moving and being part of their everyday lives, We have fitness facilities up and down the country empty between 9 and 4 in the morning. Why aren't we utilising them as part of the school programme? You know, there's so many different things that we can have, but I think what we first need to do as a room of coaches is to recognise the importance we have and the importance we play. Like, as I said a moment ago, I'm a chemist, and I was out with a group of my friends, and most of us would be PhDs or whatever, you know, and one of Jamie's, my husband's, Jim's managers was out for dinner with us, and we were all talking about what you do, you know, the usual. And we came to this lady. Now, this lady is a rock star. She has more impact on people than I'll ever have. And when we went and they asked her what her job was, she said, I'm only a coach. And that's the perception. That's how we treat coaches. That's how we pay them. And it seemed like, in a lot of instances, it seems like a hobby and not a career. And that has to change. So we need government to recognise that, and as an industry, we need to recognise it, you know. And that's why I'm here today. About 14 months ago, I formed the Irish Physical Activity Alliance. And that's a coalition of doctors, medics, etc., changing or trying to change government policy. And probably seems a bit mad to sit in your sofa and go, sure, I think I'll change government policy. But sure, what can you do? I emailed them several times as Darina from IPAA. I emailed them from Darina from Filthy 150. Never got a response. I emailed him as Darina as the Vice President of a division for Merck. I had a response within 2 days. So I went in and I sat with Jack Chambers, who is great, to be honest with you, but we had a different conversation than we thought. So the reason the IPAA was formed is to change government policy and to get physical activity and preventative healthcare at the cornerstone and at the forefront of our healthcare system. And in 14 months, I'm really happy to say we've had substantial impact. In the last budget, Minister Chambers read into it all for the first time, the importance of preventative healthcare, and what was critically important, he said, was and the role of gyms. Now, we had to fight hard to get that because gyms don't have a lobby group. GAA, sports clubs have a direct line, but we don't. We do now, but we didn't at the time. In parallel, we got both Fianna Fáil and Fine Gael to put in the programme for government, a tax rebate for gym membership and a national education campaign on the importance of strength training. And I'm pretty confident that you'll see something in the budget. I can't say for exactly what it will be, but there will be something in the budget in 28 days that will support our industry. And this is just a start, because this isn't just about a tax rebate for gym membership. This is about changing the health of the nation. To Niamh's excellent point about role models and peers. If your parents are physically active, you're 6 times more likely to be active as a child. If we're talking about really being sensible and having a strategic healthcare policy, we need to have policies that affect people in midlife. We need to have policies that affect people as they age. But a long-term strategy is supporting kids to develop healthy life habits, because not only will it fundamentally change their lives, but it will fundamentally improve the exchequer. You know, we're facing a critical role in Ireland at the moment. In 10 years, there's going to be more people on the island over 65 than under 18. We can't continue just to pay for sickness. We have to keep people healthy for longer, and that involves creating healthy habits, and those healthy habits have to start young. So, Stephen, I really want to commend you for hosting this, because this is unbelievably important and it needs to expand and grow, because we need everyone to know that your health care needs to start with health. And it doesn't start with disease management. And what you're doing every day in the gym is creating that conversation, and we need more of it. So before I sit down, I want to ask a favour. You know, as I said, it was a bit mental to say, let's change the health of the nation, but I read a quote once, you know, a small group of committed individuals can change the world. In fact, it's the only thing that ever has. And I know the Irish fitness industry is a small group of committed individuals. So I'm asking you, over the next 2 weeks, if you have 5 minutes, send an email to your local TD. Tell them that they want and should support physical activity in Budget 2026. You don't think it'll have an impact, but it'll have a huge impact, because all politicians, in a lot of instances, care about is votes. And the Irish fitness industry represent 800,000 votes. And if they do support us, we'll work with them. So please take that minute, send the email, tell them the impact that you have, tell them the impact you have in your communities, because this is healthcare and this is what we should be doing. Thank you very much for your time.